So you or a loved one has been diagnosed with dementia. Now what? First, although it may seem strange to consider yourself fortunate, the sad truth is that the majority of patients with dementia go undiagnosed during their lifetime. A recent report from the organization Alzheimer's Disease International revealed that up to 75% of all dementia cases go undiagnosed across the globe. The situation is even more dire in low to middle income countries where 90% of cases remain undiagnosed. Stigma among medical providers remains a significant barrier to diagnosis, as 1 in 3 medical professionals believe nothing can be done for dementia. Although dementia is not a curable illness, receiving a specific diagnosis is a critical step in the management of dementia. Additional studies reveal that 85% of individuals first diagnosed with dementia are diagnosed by a non-dementia specialist, usually their primary care provider. Unspecified dementia is the most common diagnosis given by non-specialists. There are many types of dementia, including Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia, among others. More accurate identification of dementia type may lead to better treatment for symptoms, enhance knowledge of medications that may worsen symptoms, and inform disease progression over time, as well as encourage advanced care planning. The types of physicians that are recognized as dementia specialists can include geriatricians, geriatric psychiatrists, and behavioral neurologists. Unfortunately, there's a severe shortage of these specialists across the country. This often leads to long wait times for specialty dementia care. I would encourage any person diagnosed with dementia or their family members to discuss with their provider what type of dementia is felt to be responsible for the underlying symptoms. This can assist in directing individuals to the most appropriate educational materials and anticipate what the future may hold as dementia progresses. Although dementia diagnosis can often be quite challenging, newer diagnostic advances such as biomarker testing, blood tests, and advanced brain imaging techniques are improving the accuracy of diagnosis among both primary care physicians and dementia specialists. Many studies have shown a majority of clinicians feel nothing can be done for persons living with dementia. This has been referred to as therapeutic nihilism and is a significant barrier to optimizing care. Medications for the treatment of dementia, particularly Alzheimer's disease, have been available for over 2 decades and have repeatedly shown improved outcomes compared to lack of treatment. More recent studies have found that treatment of dementia with conventional medications may reduce the risk of death by up to 30% compared to no treatment. Traditional medications to treat dementia are divided into 2 main classes and work by different mechanisms to affect brain function. The first class of medications includes drugs referred to as cholinesterase inhibitors. These medicines work by increasing levels of a neurotransmitter in the brain, critically important in aspects of attention, memory, and other cognitive processes. Currently, there are 3 types of these medications, with most studies revealing no significant differences between the 3. In other words, they all appear to be equally effective. Most patients tolerate these medications well, but a trial of an alternative agent is often well tolerated among those who develop side effects. Many times, I've seen patients who've had side effects with one of the medications do quite well on an alternative. Given the previously discussed benefits, it's important not to give up if one medication causes troublesome side effects. Another medication used to treat dementia is known as memantine. This medication works on a different neurotransmitter and is often combined with cholinesterase inhibitors. This medicine is actually most useful when dementia has progressed to the moderate or severe stages. However, some persons find it useful in more mild stages. This medication is usually well tolerated. Although both types of medicines are FDA approved only for the treatment of Alzheimer's disease, they are often very useful in other types of dementia, regardless of cause. In some conditions, using these medications may not be advisable, so speaking to your dementia specialist or primary physician is essential before starting. The most exciting development over the past year or so has been the development of disease-modifying therapies for Alzheimer's disease for use in the earliest stages. At present, there are 2 FDA-approved medications that appear to slow the progression of Alzheimer's disease in those diagnosed very early by around 30%. These medications are infusions through a person's vein that remove amyloid protein from the brain. Unfortunately, only a limited number of patients will be eligible for these treatments, as patients need to be diagnosed with Alzheimer's disease at a very early stage. Because these medications have stringent criteria for eligibility, only about 20% of patients with dementia will likely be eligible for treatment, emphasizing the need for early and thorough diagnostic evaluations. Nonetheless, we feel it is essential to identify Alzheimer's disease at an early stage and allow patients to decide if these new treatments are right for them. At present, these medications are generally only available from dementia specialists. This is an exciting time as these medicines represent only the beginning, and new therapeutics will likely become available in the next several years. There's much to consider when evaluating and treating patients with dementia. In addition to diagnostic and treatment considerations, it's important to consider care planning. During the course of dementia, many complex issues can emerge and require difficult decisions to be made. Issues such as the capacity for safe driving and the ability to make decisions regarding one's living arrangements or financial affairs inevitably arise as dementia progresses. The development of psychiatric and behavioral issues such as agitation and psychosis can challenge caregivers, and burnout is a genuine concern. It is most helpful if these issues are planned for in the early stages when a person with dementia retains the capacity for planning their own future. Utilizing additional resources such as social workers, allied health professionals such as occupational therapists, physical therapists, elder care attorneys, and organizations such as the Alzheimer's Association and support groups can be extremely valuable. It is advisable during office visits to try and prioritize concerns and issues that you wish to be addressed. Regular follow-up for patients with dementia can serve to provide ongoing education and address these challenges and issues over time.